Hi, my name's Jessica Sean. This little video is for Dr. Robinson. It's on policy, social policy, and what social policy needs to be changed. So social policy refers to both the social decision-making process by which a course of action is selected, defined, and promoted, policy making, and the product or outcome of that process, the resulting policy. Although social policy may be made in both public and private sectors, the preponderance of social policy is determined by what governments choose to do or not to do. They organize bureaucracies and programs that regulate certain behaviors, distribute services and benefits, and collect taxes. Our concern is what relationship between social policy and social welfare broadly defined. So, social policies that need to be changed, hunger and poverty are obviously huge. Women's and girls' rights, career opportunities, how career opportunities correlate to women's and girls' rights with childcare, as well as access to healthcare. So the policy change that I focused on was women's rights, career opportunities, access to affordable and good daycare. We rank in some of the lowest in we rank the lowest actually in the developed world for the type of childcare we provide. Majority were ranked by the National Health and Human Services were fair to poor, while only 10% were defined as high quality, and that's daycare providers in the United States. CCIS is through welfare, and they provide like daycare assistance. First of all, the criteria to even get daycare assistance is crazy. You have to be single. You have to be below the poverty line. It takes absolutely forever to get it. They're extremely selective in the daycare providers. And then if you can find a daycare provider that is acceptable through CCIS, then they come into their home, and basically it would be like they do a safety measure, which is good. I mean, it's good for the children. So how to solve this, and policy change would be pay women equitably to men. Women typically earn 20% less than men. To make maternity leave more manageable and paternity leave as well. And that way a woman could take like 6 months leave, and then her husband could take 6 months leave, and that would be the first year of the baby's life. Also take restrictions off FMLA, Family Medical Leave Act. So as it stands right now, the company that you work for has to have 50 employees, and there's a lot of stigma involved with taking FMLA, so a lot of people don't even try to apply for it. Also, if you're a contract employer, or you have to be at an employer for a certain amount of time, I believe it's over a year to even get FMLA. So they can engage training and licensing for childcare workers, compensate them better, and parents are able to focus in the workforce. And if they cannot afford the childcare, then they could compensate the parents for the childcare, so they can, focus on their career more. Another policy that I would like to see change would be to relieve burdensome student loan debt. The interest rates once you're out of school immediately skyrocket through Sallie Mae and different federally funded loans. And, with cost of living, inflation, our minimum wage hasn't been raised in years. It's not even a living wage. So, to make education free or even remotely affordable would be amazing. And then, like I said, relieve student loan debt for people that have it now. Then people can focus on being productive, enriching careers, and giving back to the economy. So poverty itself is a huge multi-faceted issue, but when people don't have their needs met, it leads, especially in children, it leads to ill health through nutrition, housing, and environment. People in the worst health typically receive the least services. That's because people in poverty normally don't have good health care or access to good health care. There's major inequalities in access to care according to social class. So, the lower your social class on the socioeconomic rung, the less access you have to healthcare and the poorer your health. So access to healthcare is not necessarily based on income. This is the hope, or through your job, because people switch jobs so often that if healthcare could be based through the government, then they would have much more stable healthcare. Hospital care, when people don't have decent long-term health care, hospital care is shorter durations, in particular mental health care and rehabs. So they're not getting the care that they need. PCP, when people have bad health care, they go less. And they're getting less preventative health care as well. And then in terms of public health, when people are in poverty, their water systems are not as good, whether that could be lead in their pipes, etc. Sewage, lead-based paint, like they're not in as safe of environments. So, my primary things to focus on would be alleviating poverty through social service help, helping parents with childcare, helping equal access for mothers and any women for pay, and then career opportunities. So that's all. Thank you.